Hey guys, Austin here from Thrive. I just wanted to hop on and shed some light on November being Lung Cancer Awareness Month. Our lungs work quietly every moment, keeping us alive, but lung cancer remains one of the leading causes of cancer deaths worldwide. In this video, we'll explore what lung cancer is and learn 3 simple breathing practices to help you strengthen your lungs and become more aware of your breath. Lung cancer can be categorized as an abnormal cell growth in the lungs that can block airflow and damage tissue. Some risk factors of developing lung cancer are smoking, pollution, genetics, and occupational exposures. Symptoms to watch out for are persistent cough, shortness of breath, chest pain, and unexplained weight loss. Just a friendly reminder that early detection saves lives. Routine checkups matter. Even if you have no history of being a smoker, 20% of lung cancer diagnoses are found in people who have never smoked a cigarette. Tip number 1 is going to be nasal breathing on a walk. So we're talking about oxygen efficiency and how that is important with lung capacity. So I want you to challenge yourself that on your next walk, try to only breathe in and out through your nose and pay attention to the duration of your walk and kind of how long you can walk and keep that consistent pace with your nasal breathing. And try to do this about 3 or 4 times a week and pay attention to not only the pace and the cadence of your walk, but also the duration, how long you can walk with just nasal breathing. And each week, try to progress either by a longer duration or by picking up your pace. This will help you become aware of how cognizant you are with your nasal breathing, but also your lung capacity. So take this tip and let us know how far, how long you get to walk with just nasal breathing. Okay, so tip number 2, we're gonna talk about nasal breathing and adding movement with our breath. So I want you guys to try to fit this into your daily schedule. So maybe before you sit down for a meal, whether that is breakfast, lunch, dinner, but we're gonna try to add squats in with our breath. So what I want you to do is either find a chair or do them freestanding, but you're gonna inhale down and exhale out your mouth on the way up. And I want us to kind of keep track of either when our muscles fatigue and we start to feel a little bit of a burn, or we start doing as many repetitions and our breath starts to change. We find that kind of feeling that I want to take a breath in through my mouth. So try to do this 3 to 4 times a week and pay attention to how many repetitions it's going to take you to either feel that burning sensation in your legs or change the cadence of your breath. But that's tip number 2. Okay, so for our 3rd tip, we're going to talk about the candle breath. Imagine that you have a candle in front of you and you're going to take an inhalation, and through pursed lips, I want you to try to exhale as slow and controlled as possible, and almost imagine that candle, you're not trying to blow it out, but you're just trying to have it flicker a little bit. So you want to really control your exhale, and you're going to notice that it's going to be a lot longer than your inhale. So I want you to try this for about 10 repetitions and see if you can do this for a week straight. So either pick maybe in the morning or in the evening before you're going to bed, but just practicing 10 breaths in a row of that inhalation through your nose and that slow, gentle exhale. And try to make it as smooth and comfortable as possible. And just take notes every day of kind of your progression and how comfortable it starts to feel. And that's our tip number 3. Your lungs are your life force, so keep them strong with mindful nasal breathing, regular movement, and awareness. And remember, if you ever notice unusual changes in your breathing or cough, talk to a healthcare professional early. Breathe mindfully, live fully.